Our founders created KID out of an urgency to protect children from dangerous products. Their son, Danny, died when a poorly designed, inadequately tested crib collapsed around his neck. What they learned from that tragedy informs KID's mission: to promote the development of safe children's products, to advocate for all children, and to educate the public, especially parents and caregivers, about dangerous products. We have made remarkable progress towards that goal. The world's strongest crib safety standard went into effect. A new public database was launched that enables consumers to submit and review reports of unsafe products. Recall effectiveness has been improved, and the government issued a strong warning against infant sleep positioners, a dangerous and unnecessary product KID has been warning about since 2002. In many ways, we've accomplished a big portion of our original mission. However, our work is far from finished, as children continue to be hurt and killed by unsafe children's products each year. Each year, the government estimates that 327,000 children are rushed to emergency rooms for injuries from nursery products or toys, and 100 die. And on average, each week, more than 2 children's products are recalled because of the safety hazards they pose to our children. The next phase of KID's work will focus on increasing transparency in the children's product safety system. Access to information is the key to helping the public learn about and avoid unsafe products. Our approach is proactive. We promote the development of safer products through stronger testing standards. Plus, we have developed a program to encourage young engineers to keep safety and product design uppermost in their minds. KID continues to work to change attitudes and build communities by reaching new populations of parents and caregivers with our life-saving message. In a New York Times op-ed piece, Robert Adler, a commissioner at the Consumer Product Safety Commission, or CPSC, said this about safety: "Health and safety agencies rarely impose new costs on society when we issue safety regulations. We simply reallocate who pays the costs. KID's objective is to be a fierce advocate to keep children from paying the cost for unsafe products." In 2008, Congress passed a bill called the Consumer Product Safety Improvement Act, also known as CPSIA. This law, with portions named for our founder's son Danny, will keep children safer than ever before. Because of this new law, there is now a public database called saferproducts.gov. Most importantly, it puts into place mandatory standards for infant and toddler products. The law requires independent third-party product testing and limits the amount of lead and harmful chemicals that can be used in children's products, among many other important changes. KID is looking to the future and adapting our work and our goals in the context of the new children's product safety landscape. The CPSIA has compelled the Consumer Product Safety Commission to create mandatory standards for infant and toddler products such as cribs, strollers, and high chairs. KID is the consumer's representative at product standard setting meetings and has served the public in this capacity since our founding in 1998. We help ensure that hazards are addressed through performance testing and design process standards. Through KID's innovative educational program, Teach Early Safety Testing, or TEST, we also work to integrate product safety standards and testing practices into the engineering curriculum. Each academic term, KID works with engineering students to examine and fix design flaws in children's products. We do this by teaching them to address weaknesses at each stage of the product creation process, from idea generation to product testing, and from manufacturing to distribution. CPSIA's enactment is bringing about unprecedented changes to children's product safety oversight, but the process hasn't been easy. There have been ongoing attempts to weaken or defund various provisions. KID pushes back against these regressive efforts while also closely monitoring the implementation of CPSIA regulations to make sure that the strongest interpretation of the law is adopted. Even with the progress we've made on the national level, critical product safety issues remain that can only be addressed at the state level. In most states, there's nothing to prevent the use of recalled products in childcare facilities, and not enough is being done to identify products that might be involved in infant deaths. As we have in Illinois and many other states, KID will continue to encourage state lawmakers to enact legislation on these issues and in all areas of child safety. Through our Safe from the Start program, KID reaches families, caregivers, and healthcare providers across the country with life-saving product safety information. In coming years, KID will focus on one of the main areas that is not adequately addressed by CPSIA, improving recall effectiveness. The crib that killed Danny had been recalled 5 years before his death, and yet no one at the child care or the state inspector who had visited a few days earlier knew of the recall. An analysis of 4 months of consumer filings submitted to saferproducts.gov revealed that still 1 in 7 reports involved a recalled product. This report contains concrete evidence that recalled products continue to hurt and kill children long after the initial recall. As KID has done since our founding, we will continue to focus on removing recalled products from our homes and childcare facilities. KID is also adapting our message to reach populations with tailored product safety information. Toward that end, KID developed the Debbie Saya Grandparent Outreach Project to develop specific safety materials to meet this population's needs. Debbie was the grandmother of Andy Sage, who suffocated on an infant sleep positioner. When she died, her friends and family donated to KID to support outreach to other grandparents in her name. KID is working to meet the increasing demand for our programs and services. In these difficult economic times, more families are using their child care products for longer periods of time. Many cannot afford to purchase new products and are dependent on secondhand items to meet their children's needs. Getting accurate information to them about the products they are using is vital to keeping their children safe. KID is uniquely positioned to help save children's lives. Our exclusive focus on children's product safety allows us deep penetration into all the nuances and fields related to this issue. But our focus on working together with other children's safety and consumer organizations gives us reach that belies our limited budget and staff. As KID's Executive Director, I have over 30 years of experience in conceiving, building, and directing organizations to investigate a wide variety of consumer issues and to craft solutions. KID's success stems from having a rare combination of experienced staff and board members teamed with deeply committed parents, many of whom have lost children, and the ability to generate media and public support for our policy initiatives. In addition, while national attention turned to product safety in 2007, also known as the year of the recall, KID had already been laying the groundwork for almost a decade. KID drafted early legislation that would eventually be incorporated into the CPSIA bill. We conducted research that exposed product safety oversight weaknesses. KID worked diligently to raise awareness of the dangers of using recalled products. We partnered with national news outlets and developed resources to educate families on the life-threatening hazards posed by using unsafe products. These efforts have led directly to the vast changes in the product safety system that currently exists. 10 years of dedication and hard work have enabled KID to emerge as a trusted leader in the post-CPSIA landscape. Our methods work. KID has historically walked alongside the families of victims to advocate higher safety regulation demands. Our pioneering research and tracking of recalled products puts KID ahead of the curve on product injury trends and product testing deficiencies. Additional resources are desperately needed to continue with the life-saving work we are accomplishing. Since our founding, KID has worked to implement a comprehensive strategy that eliminates unsafe children's products. We do this by addressing weaknesses that persist at each stage of the lifespan of a product, from idea generation to product testing, from manufacturing to distribution, from the initial recall to the product retrieval process. This multi-pronged strategy allows us to identify and reform the core problems that are causing the serious injuries and, in many cases, the deaths of our children. KID also establishes strong connections and close partnerships that allow us to work in local communities as well as on a national or international scale. KID's first action was to pass an ordinance in Chicago that banned the sale of recalled products. Next, we created and passed the Children's Product Safety Act in Illinois, making it the first state to ban the sale of recalled products or their use in child care facilities. Locally, we have allied with healthcare providers and organizations. We have partnered with Children's Memorial Hospital, the Illinois chapter of the American Academy of Pediatrics, the Illinois Public Interest Research Group, public officials including the Illinois Attorney General and several congressional representatives. These alliances give breadth to those we reach with our safety message and give depth to our ability to advocate for solutions to unsafe products. On a national level, KID works very closely with the nation's largest consumer groups, Consumer Federation of America and Consumers Union. Together, we represent the interests of children's safety in the halls of Congress and in the hearing rooms of the Consumer Product Safety Commission. Additionally, I serve on the board of the International Consumer Product Health and Safety Organization, a group that brings together a variety of public sectors involved in consumer safety to discuss product safety problems and to brainstorm effective solutions. True success for Kids in Danger is an absence of preventable injuries and deaths from unsafe children's products. On the surface, that might seem impossible to measure, since what we are talking about is a prevention. A successful day for us comes in the form of stories from parents who report removing their sleeping child from an unsafe crib that they learned about from KID, or listening to a parent who replaced a defective car seat or baby stroller or high chair before an incident occurred with their children because they learned from KID that their product had been recalled. We celebrate the days when we learn about a child who didn't suffocate on a crib bumper because she was sleeping in a bare crib as recommended by KID. We are proud to be able to report substantive, concrete, and historic steps forward on our mission to improve children's product safety in recent years. These include the launch of saferproducts.gov, the public database that records incidents related to faulty products, the adoption of the world's strongest crib standards, the new guidelines for the American Academy of Pediatrics warning parents against the use of crib bumpers, the new, stronger testing standards being published every few months by the U.S. Consumer Product Safety Commission, the first formal warnings from the CPSC and the FDA on the dangers of sleep positioners, the City of Chicago's recent ban on the sale of crib bumpers. And I could go on, but I think you get the idea of the magnitude of our work. We can say, without a doubt, that children are safer today because of these efforts. Our educational programs are effective. KID is able to track the impact of these through quantitative measures. KID tracks the number of educational materials distributed and the extent of the geographical area reached. We also keep a database of individuals who attend our workshops and community safety events. KID measures our social networking efforts through recording the number of subscribers to our safety alerts and recording the number of downloads of our educational resources. We keep track of the number of individuals who view our videos, along with the robust growth rates of our followers on Facebook and Twitter. KID uses qualitative measures such as focus groups, interviews with parents, and survey results to improve our programming and to develop resources to reach new audiences. Here's a secret about KID. We are really small. Members of the media and others often say that our operation is much smaller than they imagine, given our impact, scope, and national reputation as the most highly regarded juvenile industry products watchdog. We have learned to do a lot with a little, but imagine what we could do with a robust budget and staff members to address all the work that needs to get done. We are also focused very narrowly on product safety, assuming that if the products they use are safe, parents can better care for their families. There are other groups doing parent education on how to parent or to keep your child safe in sports, for instance, so we stick to what we think is the key: a safe place to sleep and the knowledge that if you buy a nursery product to care for your child, it won't injure or kill them. People who have visited our website's Family Voices section know some of the heartbreaking stories we hear from parents whose children have been injured or killed using unsafe products. Phone calls from these parents are the hardest part of my job. But the parents are so relieved to find an organization that will listen to them, that will fight in their children's memory, and that gives them a voice. We feel privileged to do our work in honor of these children. And finally, because we were founded by parents who lost a child, many believe we are funded through an endowment or other large sum of money. Linda and Boaz and all of our supporters have been very generous. Others believe that we are funded by funds from the government. But the truth is that KID relies mostly on small donations from a core group of supporters who see the need for grieving parents to have a voice. We have limited access to foundation grants because of our advocacy for systemic change, and we fiercely guard our independence in order to adhere to our mission. We have turned down significant contributions from manufacturers and other special interests. We raise all of the funds for our annual budget each year from scratch, another impressive accomplishment in these tough economic times. We want to stay scrappy, but would love to have additional funds and room to grow. From the beginning, KID has been action-oriented, making lasting change that improves children's product safety. Less than a year after our founding, the City of Chicago passed an ordinance to prevent the sale of recalled products. We then drafted and shepherded the nation's most comprehensive statewide legislation on children's product safety, the Illinois Children's Product Safety Act, through the Illinois legislature. Since 1998, we have worked to pass that law, which has been adopted in 10 other states to date. Annually since 2001, we have provided definitive research on the state of children's product safety by documenting recalls and injuries, monitoring changes to product standards, and staying current on federal law that has an impact on safety. This research has been used to inform policy discussions at the local, state, and national levels. KID provided much of the background information that initiated the Chicago Tribune's Pulitzer Prize-winning series on children's product safety. The aftermath of this series that exposed the inexcusable state of our product safety system, coupled with the flood of toy and crib recalls that followed, led to the groundbreaking Consumer Product Safety Improvement Act of 2008. KID has been deeply involved in CPSIA's passage and the provision of Danny's Law that are currently overhauling children's product safety oversight. And along the way, we have provided millions of caregivers and parents with the tools they need to keep their children safe while continuing to advocate for lasting changes to our nation's product safety net. Perhaps the biggest historical challenge to KID is that so many people aren't even aware of the need for an organization to address children's product safety. Most parents believe that if a product is on a store shelf, it must be safe. This simple common sense assumption allows manufacturers to resist change and perpetuate the status quo. KID's comprehensive approach to reforming children's product safety oversight, with a core focus on advocating for children, has at times limited the range of foundations willing to fund our mission, as many explicitly decline to fund organizations engaged in advocacy activities. For example, many workplaces have an explicit policy against matching employee donations for organizations that engage in any form of advocacy. KID is fiercely protective of our credibility as a consumer watchdog and a trusted resource for families. To ensure our neutrality, KID never endorses any company or product. Because we refuse to compromise our integrity, KID has had to turn down funding from corporate entities that would have made a huge impact on our operating budget. Since our founding, KID has been a small yet highly effective organization that has largely been sustained by a dedicated group of supporters. Over the years, KID has gained the additional support of foundations and other sources. Like many charities, these difficult economic times have limited the giving abilities of individuals and foundations that would otherwise support us. The unfortunate result is that our reserves are growing thinner. Indeed, in recent years, KID has lost key foundation grants. To adapt to new circumstances, KID is adopting new fundraising strategies with an eye toward long-term sustainability and with an emphasis on diversifying funding sources, especially through social networking. The first thing we would do with additional resources would simply be to breathe a sigh of relief that we would be able to continue to do what we've been doing. Resources are scarce, and just to keep operating at our current level will take new sources of funding. But we have concrete ideas for how we could grow given additional resources. The first step would be to hire one additional staff person, we currently have 2, who could focus attention on building our support base. This will give us the ability to be better stewards of the funds entrusted to us by supporters and give us long-term sustainability. With a firm base in place, KID could grow to fulfill unmet needs. Additional funds would allow us to build an even stronger partnership with other stakeholders, people already reaching parents and caregivers who could help carry our message. We are looking to partner with organizations like children's hospitals, local coalitions of parents, and social media networks such as online communities for new and expecting parents. Resources for travel expenses would enable us to increase our reach in other areas and be a stronger presence in Washington. We must keep the needs of children more squarely in front of the regulators and policymakers. We will never change our core mission of improving the safety of children's products and advocating in honor of the children who have been injured or killed by dangerous products. Their voices will always be our guide. KID has done amazing work here in Illinois, making it the true epicenter of children's product safety nationally. We have an Attorney General who keeps this issue on the front burner, reporters who make it a priority to cover this important issue, and landmark legislation that keeps our children safe. We would love to meet this need in other states by supporting their consumer and children's advocates with our materials and assistance. Every service provider and caregiver that works with young children and their families needs our life-saving information and can be an advocate for safer products. KID has successfully structured our outreach programs to give organizations already working with this population the tools they need to advocate for product safety for all children. But the universe is large and we've been able to reach only a small number of people so far. Social media has helped give a voice to the parents we work with so they can share their stories with others. But we lack the time and resources to strengthen that effort and to build a nationwide network of families who support each other and carry our message.